Okay, so now we are going to learn about the articulating disc, articular disc. As you can see this cut section, you see the outer layer, which is basically the cut section of the fibrous capsule, and within this is the synovial cavity, and this orange portion is the lining, which is synovial membrane, and we can see the articular disc, which is dividing the synovial cavity into an upper compartment and lower compartment. Okay, and here we can see the articulating cartilage, which is fibrous cartilage. Now, this upper compartment is named as menisco-temporal compartment between the meniscus, that is articular disc, and the temporal bone. So it's called as menisco-temporal compartment, and the lower compartment is called as menisco-mandibular compartment. Okay, so there are going to be like interesting movements occurring in these two compartments. And as you can see, this is an actual specimen of this TMJ, a cut section. This is the upper compartment, this is the lower compartment, this is the head of the mandible. Okay, and as we can see, this dividing part, this is the articulating disc, articular disc. Okay, so in this line diagram, as you can see, this is the articular disc. If you notice here, from anteriorly, okay, we have some muscle coming in, inserting into this region, like medial aspect of the neck of the mandible, that is in the pterygoid fovea. Which muscle this is? That is the lateral pterygoid muscle. Next, if you see within this joint cavity, we have this articulating disc. It is basically, it's known that it's a degenerated insertion of the lateral pterygoid, right? So you can see the close association between this TMJ and the lateral pterygoid. So this is basically the degenerated insertion of the lateral pterygoid muscle. In the future slides, you will see like how important lateral pterygoid is and how important movements it is causing for this joint. Okay. Next, so what is this? It's an oval plate of fibrous tissue. Like we saw fibrocartilage above lining, and this is also made up of fibrocartilage because, as I told you, there's a lot of movement, so it has to be tough. Okay, next. Here you can see anteriorly it is attached to this fibrous capsule, and posteriorly it is splitting into two lamina, and again it is inserting into the fibrous capsule. And here we can see there are going to be two thickenings along this disc. Okay, number one, this is called as anterior band, and this is called as the posterior band, and the region in between them are named accordingly. Number one, this is the anterior extension or anterior segment, we can call. This is the intermediate thin zone, and this is called as the posterior region, which is going to be split. That layer, that area is split into two lamina, into upper lamina and the lower lamina. In between these two lamina, here we are going to have something called as venous plexus. Okay, lodged inside it. That's why we have that splitting of the posterior region of the articular disc. Okay, next, this is a superior view. If you see superiorly, if you just dissect and remove the head of the remove the superior articulating surface, we will have something like this. See, you can see a thickening. This is the anterior band, and this is the posterior band, and this is the anterior extension, intermediate zone, and this will be the posterior extension. Okay, so now what is the different shapes of both these surfaces, right? So it has the upper surface of this articulating disc is going to be concavo-convex. Okay, as you can see, this region is concave and this region is convex. Okay, so the upper surface is concavo-convex, whereas the lower surface, okay, that lower surface is only concave. If you see from below, it is going to be only concave. This will be like more easy to understand if you see the actual structure. See here, anteriorly it is the upper surface, anterior it is concave, and posteriorly it is convex because of that thickening. Okay, whereas the lower surface is going to be only concave. Okay, so this is why the shape difference is happening. And why do we have these two compartments? Because in the upper surface there is going to be only simple gliding movement happening. Okay, whereas in the lower compartment, because we have the head of the mandible associated with it, there is going to be a little bit of rotation movement happening here. Okay, and gliding movement will happen here. Okay, so in the upper compartment there is going to be gliding movements, whereas in the lower compartment it is going to have both gliding and rotating movements. Okay, so this is regarding the articulating disc. Okay, now we have to know what is the relations, what are the structures associated with this joint. Okay, so I always tell everyone to learn relations like you're a surgeon. Okay, let's say tomorrow you have a surgery. Imagine you are going to work on TMJ tomorrow. Okay, and you have to make an incision from the superficial skin and go layer by layer. Okay, so now imagine you are going to just today revise the anatomy of this joint, and tomorrow you have to know like what is the first layer that you are cutting, then what structure will I encounter, right? So if you think like that and learn, it will be much more interesting. So if I consider everyone watching as a surgeon, okay, so first we are going to learn about the lateral relation. What are the structures you are going to come across from the lateral aspect? Okay, so number one, obviously it is going to be skin, isn't it? The first thing you are going to cut as a surgeon is going to be skin. Then you're going to have the fascia. Okay, so in the face, here we have this parotid gland. On top of this there is going to be a thick layer of parotidomesenteric fascia, right? So that will be the second structure that you will be encountering. After that, what you're going to come across is this gland, which is the parotid gland. And deep to the parotid gland, we know one nerve is like traveling within that gland. Okay, one of the most important nerve of the face. Injury to this nerve might cause Bell's palsy. That is the facial nerve. Okay, so in the facial nerve we have this temporal branches. So here we have the TMJ within this, right? So which branch of that facial nerve will you go across? That will be the temporal branch of the facial nerve. Okay, so from superficial to deep, you will have the skin, then parotidomesenteric fascia, then you will have some of parotid gland, and then we will have the temporal branches of the facial nerve. Okay, so next, medial to it, like from laterally you have reached the TMJ. Okay, medial to it, within this joint, what are the most important structure that's going to be there? Okay, like always you remember, in relation with TMJ, two nerves and one vessel, they are running very very close to this TMJ, and you cannot injure these structures, right? So this picture, if you see this picture, this is of the right side's TMJ, and this is the inner aspect of the right side ramus of the mandible. Okay, so here we have this anterior aspect, this is the posterior aspect, this is the cut section of the mastoid process. We have the stylomastoid foramen, and then here I'm having the head of the mandible. Here this is the neck of the mandible. In relation to the neck of the mandible, I am having one muscle, which is the lateral pterygoid muscle. Okay, so on the other side of this image we'll have the skin, right? So if you see, there are like two nerves I'm able to very well see in this picture going along this head of the mandible. Okay, number one, this nerve. Okay, as you can see, this is a branch of the mandibular nerve. This is trigeminal nerve, this is the mandibular division. From the mandibular division, I'm having one branch winding around some vessel and then going behind, winding around the neck of the mandible and going out. That is called as the auriculotemporal nerve. Okay, it's called as the auriculotemporal nerve, one of the most important structures. Next we have this vessel. Okay, so this is basically our external carotid artery. From the external carotid artery we have an important branch, which is the maxillary artery, and from the maxillary artery we have one important branch going up into the cranial cavity. That this is the middle meningeal artery. Okay, that is related to the medial aspect of this TMJ. So first we had this auriculotemporal nerve, next we have this middle meningeal artery. In the picture it might appear like it's more of an anterior relation, but in reality if you see a specimen, it will be more closely related to this TMJ. Okay, so auriculotemporal nerve we had, then we have the middle meningeal artery. Next we have one more important nerve, which is the branch of the facial nerve. Do you guys see this structure coming out of the stylomastoid foramen? That is the facial nerve. And you can see one branch traveling through the middle ear and then entering to join with the lingual nerve. Okay, that nerve is called as chorda tympani nerve. Okay, chorda tympani nerve. As you can see, this is the tympanic membrane, and this is actually the cavity of the middle ear. So it has crossed all these structures and it is entering into the infratemporal region. And again, it will go in close relationship with the medial wall of this TMJ. Okay, so imagine if you are having a patient, if you have to like remove the head of the mandible in case of any carcinoma, osteosarcoma, or osteochondroma, in conditions like that. Okay, so from laterally we know what are the layers we are going to approach. If you are going to remove the head, you should be aware of what are the structures lying behind that joint, right? So you should be aware of these three structures, that is auriculotemporal nerve, chorda tympani nerve, and the middle meningeal vessels. Remember, look, okay, there are these three guys lying medial to this. I should not injure them. Okay, and if at all, if the patient is having like a punch injury, like so severe that the head of the mandible got displaced, okay, and it is going to compress some structures. In that case, also, which nerves will be compressed? Auriculotemporal, chorda tympani, and middle meningeal artery. Okay, so these structures are that very important. Here again, you can see I've kept this picture to show you this auriculotemporal nerve. है ना? Like here we have the temporomandibular joint. Anteriorly, this is the lateral pterygoid muscle, and medial to that we have somebody coming in relation to the neck of the mandible and to the TMJ, and then it is winding around behind also, and it is going towards the scalp, going towards the auricular region. Okay, that nerve is our auriculotemporal nerve. Like it is going just in front of the auricle and it is going towards the temple. That's why it's called as auriculotemporal nerve. Okay, right. So next, what are the anterior relations? Like if you see, superficially we know, deep to that TMJ, medially we know what is there. Anterior to that, which muscle is related? Okay, here you can see this is our favorite muscle, that is lateral pterygoid muscle, which is going to come and insert into this pterygoid fovea as well as into the fibrous capsule of this TMJ itself. So that is the most important relationship. Okay, next we have this structure, that is around this mesenteric notch of the mandible we will have mesenteric vessels and nerves coming out. So anteriorly they are also related. So anteriorly we have two structures. Number one, lateral pterygoid. Number two, we have the mesenteric vessels and nerves. Okay, next, posteriorly who is related? As you can see, very easily we can find out posteriorly there is going to be part of the parotid gland related. Then posterior to that we have external acoustic meatus is related, and then if you go further posteriorly, as we saw earlier, this nerve is going to be related, that is our auriculotemporal nerve, isn't it? So these are the different structures related posteriorly. Next, here again we have the superficial temporal artery also. So here just a quick recall, we have the external carotid artery dividing into two, anteriorly into the maxillary artery, and above it is going to continue as the superficial temporal artery. So posterior relation we will also have this superficial temporal vessels. So for now, please pause the video and try to recall the relations that you studied so far: lateral, medial, anterior, and posterior relations. Okay, so yeah, this is how it might feel like. Now there's like a lot of relations, and it may not exactly correlate, and if you see the specimens it will be way much better when you see the specimens and the structures passing medial to this joint or anterior to this joint. Okay, next, next it's very easy, like superiorly above which one is who is related, below who is related to this TMJ. As you can see, this is our TMJ, and above what do we have? The cranial cavity, right? So in the cranial cavity we have anterior cranial fossa, middle cranial fossa, and the posterior cranial fossa. So who is related to this TMJ? Above it's going to be middle cranial fossa. So if a patient is going to get a nice blow from below, imagine it doesn't happen usually, the skull bone is like very strong. Just for remembrance I'm telling you, if the TMJ head is going to like pierce and damage the cranial fossa, which cranial fossa will it affect? It will be going towards the middle cranial fossa. Okay, And inferiorly, what will be the relation? As we saw already, it's very easy. It is going to be the maxillary artery. Okay. So these are the different relations of the temporomandibular joint. Now we'll move ahead with the blood supply and the nerve supply. We all know if a vessel is going to go very close in relation to a joint, that vessel will supply that joint, right? So here we are going to have the maxillary artery and superficial temporal artery crossing. So that will be the vascular supply, blood supply for this joint. And the nerve supply, right? Nerve supply, we know already how close auricular temporal nerve was, like winding around the neck of the mandible and then going behind in close relation, right? So auricular temporal nerve will be the first innervation. Number two, it will be also innervated by the mesenteric nerve. Okay, so that is the anterior relation we saw. So the mesenteric nerve is also going to supply the temporomandibular joints. Okay,